Good morning.
Morning.
Could you please confirm your name and date of birth?
It's Rian van Wyk and the 6th of April 1977.
Rian, good morning. I'm Dr. Swanepoel. I've been asked to do a general respiratory examination on you today. It's going to entail you removing your shirt and me touching your chest. Will that be okay with you?
That's fine.
Excellent. You can just take off your shirt while I wash my hands. Typically we do this examination sitting, but for today's purposes I'm going to have you lie at a 45-degree angle. So Rian appears perfectly healthy. I do not see any signs of him being acute or chronically ill. He's not in any form of respiratory distress. He's not tachypneic. He does not have any indrawing or accessory muscle activity when he's breathing. And I didn't notice any coughing when Rian came in. Speaking to him, there's no hoarseness of his voice and no obvious stridor. Rian, I'm going to then just, looking at your surroundings, you don't use any asthma puffers, and I don't see any, you didn't come in with any oxygen, and I didn't notice a sputum mug. We would have liked to have examined that too. So I'm going to ask you just to take your hands with your 4 fingers and just place them together. This is known as a Shamroth sign, and I'm looking, and he has a nice clear diamond-shaped gap there. So really do not have any clubbing. I don't notice any splinter hemorrhages, and there's no sign of peripheral cyanosis. If you could just turn your hands up, there's no pulmonary erythema. I didn't notice any tar staining. If you could just open your fingers and close them, open them again and squeeze mine, and there's no wasting of the intrinsic muscles of his hands and his normal strength of his fingers. Do you have any tenderness
No.
on your wrists? And we're looking for possible hypertrophic pulmonary osteoarthropathy. I'm going to ask you just to extend your arms straight, hands up, wrist cup, and just close your eyes for me. And he does not have any flapping present. You can open your eyes again, and I'd just like to feel your pulse, and pulse is normal with regards to rate and rhythm. There's no pulsus paradoxus. His oxygen saturations were measured just before the exam, and they were 98% of room air, and his blood pressure was 120/80, so I'm also happy with that. Rian, I'm going to ask you just to look up for a moment, and there's no pallor, no jaundice. Looking at Rian's cheeks, they're a normal pink color. I don't see any evidence of facial plethora. Also looking in his eyes, I just want to have a look at your pupils. And here I'm looking for the possibility of Horner syndrome. If there was Horner's, I'd expect a constricted pupil. I would notice ptosis of his eyelid, as well as anhidrosis, which he doesn't have. Rian's lips are of normal color. Open up for me and stick the tongue out. It is pink, so no signs of central cyanosis and no obvious dental abnormalities. I'm just going to feel your trachea, and his trachea is central. Breathing deep and exhale, and there is no tracheal tug. And also just feeling for lymph nodes. We'll repeat this when he's sitting up straight, and the ideal position to examine the lymph nodes will be from behind. Rian, I need you just to turn to your side. I just want to have a look at your JVP, and I'm going to be measuring the JVP from his sternal angle, the vertical height, looking for the highest pulsation in the vicinity of the sternomastoid muscle. There it is. And we are going to measure it, and it is 3 centimeters, which is normal. Then I'm going to squeeze on your lower legs, and I just want to determine whether or not you have edema, which you do not have. And then I'd like to compare both lower leg circumference. We just want to make sure that you do not have an underlying DVT, but these are nice and symmetrical. Looking at his feet, once again, no peripheral cyanosis and no clubbing. His feet look perfectly normal. Lastly, Rian, we'd like to do what's known as a pembertons test. So I'm going to ask you to raise your arms above your head for 1 minute. You can drop your arms again. So after 1 minute, if it was positive, I'd expect Rian to develop facial plethora, central cyanosis, develop an audible stridor, and there would be a non-pulsatile raise in his JVP. Rian, the nurse will be here shortly. She's just going to measure your temperature for us still. But everything looks perfectly normal. I do not see anything that raises concern. So we will proceed to examining your lungs, doing a focused respiratory examination. But for now, everything is normal. So you can first get dressed. Thank you very much.
Thank you so much.